Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bulifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
We talked about the cervix, and we talked about enemy number one for fertility, for having a baby, is chlamydia. Why enemy number one? Because that is the most common. So a disease that is most common, that will make it number one enemy, and that is chlamydia. Chlamydia most of the times is asymptomatic. Asymptomatic meaning you do not feel it, especially in a woman, you don't feel it. When it becomes too much, okay, and then you will have, in a woman, you will have what is called pain during or immediately after sexual intercourse. Anything that touches the cervix in a woman, in this case, the woman will have pain. We call it cervical motion tenderness. You touch the cervix, the woman will jump, the woman will feel the pain. So this is on clinical examination, on vaginal examination. Even you at home, when you have sex and you see that you're having pain, most likely you're having chlamydia. So you should be checked for chlamydia immediately if you think there is pain during or immediately after sexual intercourse. Why is that? Because chlamydia causes cervicitis. Cervicitis meaning inflammation of that cervix. Cervix, cervicitis, anything that ends with itis, that means inflammation of that specific place. So we have inflammation of the cervix. So what does that mean? Well, when things get inflamed, they get swelled. And when things get swelled, especially, if you have cervicitis, for example, that means the canal, the cervical canal, is not functioning very well. And when things get swelled, that canal diameter, the diameter of that canal will definitely get less. So that is less chance for the sperm to pass. What else in that cervix? We have mucus. We have mucus. Normally, during the month, okay, especially in a phase that is before ovulation, the mucus is very much thick. Thick meaning, like a mucus plugs. Thick meaning it cannot allow anything from the vagina to ascend, to go up. Especially we have normal flora in the vagina. Vagina is just like the mouth. The same, very much the same flora of the mouth is the same flora that you can find in the vagina. They're very much the same. So now, when we have this bacteria, flora meaning bacteria, good bacteria that has to be there. So if it ascends up to the uterus that is supposed to be sterile, that will give us problems. So in order for us to protect the uterus, we'll have to have those thick mucus plugs to prevent anything from the vagina to ascend up. So then the question would be, how then will the sperm go up and penetrate that thick mucus, makes it all the way to the uterus, if what you say is correct? Well, yes, I am correct, and this is exactly the scenario. It's just that for a simple alteration of that mucus during ovulation, the mucus becomes very thin and watery. So when it becomes very thin and watery, the sperms then can pass. The sperms then can pass. So those are the problems that are, unique to the cervix. So we can also have internal polyp, and when we have internal polyp, that will also limit the movement of the sperms through the cervical canal to the uterus, and that also creates us a small problem. So we have to be sure the cervical canal is patent, is nothing in the way to block the passage of the sperms into the uterus. We have to make also sure the mucus get liquefied and becomes like water during ovulation so the sperm can pass. This is very much the most important things about the cervix. And we said enemy number one is chlamydia. So chlamydia can cause inflammation of that cervix, but this is not the only thing chlamydia can do. Chlamydia is very bad, even though it's a very easy to treat disease, but it can also go to the tubes, go to the fallopian tubes, and cause very bad damage that is irreversible. Which is that damage? This damage is internal adhesion. It causes what is looks like a spider web, but is inside the tube. And this tube, if you remember, is one cell thick. That is not so thick, it's very thin. And inside that very thin tube, we have a spider net, like we call it internal adhesions. And that, of course, clogs up the tubes, especially if it's very thin. If the tubes get clogged up by what is this spider net or internal adhesion, we cannot fix it. There is no laparoscope to fix it. There is nothing you can fix it, because how are you going to deal with something that thin and that delicate? You cannot. We can only do external adhesion if you have, let's say, an old surgery and some of the blood was left in, and then it causes what is like web, spider web. Then we can cut them off and lyse them and do. But if the adhesions are inside the fallopian tube, it's very much difficult to deal with, and that will be infertility. So that is two things those small chlamydia has caused you, and that is very painful to know that such a small thing, such a small bacteria, intracellular bacteria actually, can cause all this damage, and we can easily prevent the transmission of chlamydia from one to another by just taking the test and make sure the sexual circuit stay close to those who are not infected. So, the treatment is very easy. So, one thing to add, chlamydia never comes in by itself. It always brings her friends with her, like gonorrhea, like other aerobes, anaerobes. You get a multi-microbial infection. That is why it is very wise when we treat, we don't treat only chlamydia. We treat multi-microbial, because everything is there. Why everything is there? Because the cervicitis that has been caused by the chlamydia, we have a very delicate tissue now that is vulnerable to a lot of microbes. So we have to treat as multimicrobial, meaning not only chlamydia. We're going to move on to the next part, which is the uterus. The uterus is just a cavity that the sperms passes through, but don't forget, the uterus held the sperm by some kind of movement to make the sperms move forward. Again, the same talking, like this, the uterus has to be clean. So what is the problem that we can find in the uterus that prevent you from getting pregnant? Well, the problem is something called myomas or fibromas. There are two types of fibromas. The ones that grow from outside the surface of the uterus, that is no harm, is no big deal. It will not affect. The only one that we really care about is the one that grows within the wall of the uterus. Imagine, the uterus is like a balloon. When the pregnancy is inside, the pregnancy is supposed to expand. As age advances, the balloon or the uterus now is very flexible, and it goes bigger and bigger and bigger and bigger. Now, if you have something inside the wall of that uterus, and the fibroma is a ball, very solid ball of very tough material, okay, that cannot grow, is not flexible. So you're going to have a defect in that area. If the fibroma happened to be very close to the endometrium or the cavity where the baby stays, then that, flexibility, that ballooning out to accommodate the growing baby will not be happening. So as a result, you may subject to spontaneous abortion. You'll drop the baby. Miscarriage, you will drop the baby. So yes, depending on the size also of the fibroma or myoma and the proximity to the endometrium will determine what kind of risk this patient is at for losing the pregnancy. So now the second thing we say about the uterus, remember I said it in one of my sessions before, when you have a multiple sexual partners, if you are a female and you have a multiple sexual partners at the same time, that is no good. And we explained why that is no good. Because, you know, we have what is called memory cells. Memory cells is not only in your brain. There are memory cells in the heart. And there are also recently found that there are memory cells inside the uterus. The funny thing is that uterus that you think is only for babies, it has memory cells that remember the fingerprint of each sperm. Meaning if you have a husband, that uterus will remember the sperms of your man. Now, if you go out there and get another sperm, that uterus will recognize that this sperm does not belong to this uterus. The uterus does not recognize, so it has a memory cell. So what is the disadvantage here? When you have multiple sexual partners and each one of them ejaculate, now the uterus is confused because he only knows one set of sperm. He gets used to one set of sperms, and this the fingerprint that he has. The others he doesn't recognize. So when you confuse the uterus fire back at you by developing a lot of myomas, developing a lot of diseases that we know, and some of the diseases we don't even know because we didn't even discover. So that is one thing that we have to keep in mind. The uterus also have a memory cell. Multiple sexual partners is not good because that can induce a lot of diseases, among which myomas and fibromas. You know, it doesn't mean that if I have a myoma and fibroma, I have a multiple sexual partners, but I say it puts you at risk for having myomas and fibromas, okay?